He's hot, hot. Hi, Keith. Thank you for tuning in. Thank you all for tuning in. Tonight we are talking about alternative jobs for new medical coders. Should you take other positions other than being a medical coder when you first start? I've been getting this question a lot from folks like, you know, I want to be a medical coder, but I need money now. So should I take this job as a biller? Should I take this job as, you know, this other thing? You know, should I do this? Should I do this? Yes, you should. And we're going to be talking about that tonight. Hi, Jackie. Hi, Rebecca. Hi, Tina. Hi, Tangela. Thank you all for joining me on this closeout episode of the year. This is the closeout episode for Medical Coding with Bleu for 2021. This has been an incredible year for my channel. Now that we are at 15,000, can you believe it? I earned 15,000 organically grown subscribers. There was the like the stats, they put out the stats, and almost 3 million minutes worth of watch time this year. So that to me is incredible. 3 million minutes of watch time. 3 million minutes of watch time. Isn't that crazy? Hi, Christina. Oh, turn that frown upside down. Hi, Saida. Thank you for joining me. It was a horrendous day getting proctored. And Keith says, yes, patient access or register. Yes. We're going to be talking about that tonight. So I hope you all had a great day. Today is Thursday. It is the 30th of December. Tomorrow there will be no episode on New Year's Eve because it's New Year's Eve. I figured I'd give y'all a break. And then after tonight, I will see y'all in 2022. All right. So Karen 100, that's amazing, Blue. Congratulations. Thank you so much. All right. So let's go ahead and get started. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight, I am talking to my new medical coders, my newly certified, or if you're about to sit for your certification and you're just out there right now just trying to apply because you need to get a job, this episode is for you. So the thing that I tell people, especially brand new people, is number one, go get registered with a temp agency. That is first and foremost. That is your first stop, no matter what. Because at the end of the day, the people who are going to be advocating for you to get a job more than anybody else, the temp agency. Because if you're working, they're making money. So they want to make money and you need to make money. So that is the perfect place. And the best thing about a temp agency is when you get hired on with them, they will send you to whatever assignment, because at the end of the day, that temp agency is going to get calls from these employers and say, hey, we need somebody to fill a seat. And if they have a good reputation, obviously they're going to keep calling the people back. So you have to make sure that you can pass an initial assessment test from that temp agency. And you can find temp agencies for medical personnel specifically in your area simply by Googling temp agencies for medical personnel. I did this for the city of Dallas. I am not in Dallas, but I wanted to put it in a big city, and a ton of them popped up. So get yourself registered with them. Take over your resume. Make sure your resume looks really good. Make sure you have a really good cover letter. I've done many videos giving my tips about resumes. I also do resume rewriting myself. So there is a charge for that, and I will be leaving that in the information in the description box once I update this video. It is currently on any of my videos. If you watch any of any of my latest ones, it's all there. But go in, arm yourself with a really good resume, a really good cover letter, and a good attitude. If you are trying to network on the sites like LinkedIn, remember, please, that it is not Facebook. Please do not complain that you can't find a job. I see so many negative people, and it just, negativity begets more negativity. And remember that this is a professional website. These are full of professionals. This is not, your grandma and your cousin. This is like everybody there is a professional. And so once you start establishing yourself as either a go-getter or a complainer, trust me, that attitude and that reputation is going to follow you everywhere. Because while there are thousands of medical coders, it is a very small community. Everybody knows everybody. So if you're having a hard time finding a job, you can turn it around. If you need to talk about it on LinkedIn, you can turn it around by saying, well, I had my 5th interview, but that's okay. I'm getting better with my interview skills. That's, trust me, somebody's going to be looking and somebody's going to be saying, oh, that person's having a good attitude about it. Okay, well, maybe if I see something, if I see a job opening that might be good for them, they might reach out to you. So remember, you never know who's watching. So you've got to be on your P's and Q's at all times. And I'm just trying to do this to help you guys, because trust me, when I was coming up, there was none of this. But yes, so apply with the temp agency. And yes, go for those medical billing positions. Go for prior authorization positions. Go for risk adjustment positions, because those are going to get your foot in the door. I tell people, because sometimes people will ask me, well, should I do scheduling? Scheduling is sort of a dead end. Now, some people will have success with that. It is a very small number of people that will have success with starting in scheduling, because scheduling is not going to get you around the codes. It's not going to get you exposure to codes like risk adjustment, medical billing, and prior authorizations will. Those positions absolutely will get you around the coding. So if you get around medical records, now medical records, you may not be coding, but you may be handling records like in release of information and that kind of thing. You qualify for release of information positions because you've been trained with HIPAA. You have to know HIPAA, right? So because of that, that's another position you can qualify for, but that's going to get your foot in the door. You're not going to be there forever. So if you think, gosh, this job isn't paying what I really want it to pay, and I really need to make some money, you're making some money and you got in. You don't have to stay there permanently. You can just spend a little bit of time there, get to know things. And as you're there, you're going to be exposed to that facility's electronic medical record, which in turn you can put on your resume. Okay, so it doesn't necessarily mean that immediately that you're going to, be able to be plopped in anywhere. Of course, we would all love that. But until the culture of medical coding changes, the culture of health information changes, it is going to stay the same. This is why I encourage my people that are going to these degree programs. You all will be in that position of hiring one day. So when you are, think about that and remember the time that you were brand new, so that you do take a chance on those new people, and that you're not going to be stubborn and hard-headed like some of these employers to say, oh, we only want people who have experience. And when you're putting out your resume, don't limit yourself to just the entry-level positions. Go ahead and apply for these medical coding positions, because they're all going to ask for experience. All of them will. Very rarely, sometimes you get lucky and they'll say, we have an entry-level position. But I guarantee you that place is going to be so packed, because new coders don't know that they can actually apply for places that are still asking for experience. Now, when I tell you guys to apply for places that are asking for experience anyway for the medical coding side, make sure that the position is for medical coding and not something advanced like auditing other coders or doing education for providers, because you're not there quite yet. Okay, you know how to code, but you need that experience before you start doing those advanced positions. So if they say this is a pro fee position, professional fee service position, this is a position for like an orthopedic clinic or a cardiac clinic, something like that, you can absolutely try to apply for, because even though they're going to be asking for experience, as long as you put your best foot forward, these employers are going to have to take who they take, right? And a lot of times in these areas, if you are a coder who has experience, you're going to be employed somewhere, right? So all the people who have jobs already, they're going to, if they're happy where they are, they're going to stay. Well, that employer still needs somebody. So if they have somebody who's brand new, but is proving themselves already right out of the gate, that is a good first step. And they're probably say, okay, well, let's go ahead and take a chance, because we really do need somebody. If you can show that you're going to be somebody who needs very little training, that you know how to do your research, you know how to be disciplined enough to have that self-direction and not need your handheld. If you can put out that energy, you are more likely to get picked up. When I first started in this industry, I got the same slam doors in my face, the same, oh no, we want experience. I went through this for 2 months and it was misery because I was still, while I was looking for a job as a medical coder, I was still working at a halfway house. I was still bartending. So I was doing a lot of those hard physical labor jobs. I was still cleaning houses. I was still doing a lot of those things, trying to stay financially afloat. And I was still struggling. And I was just like, I just need to be able to get in. But having that part drove me to be like, okay, I can't keep doing this. What am I going to do? So my mom had actually been the one to suggest that I go back to the school and see what they can do. And when I did, the principal was like, okay, I know somebody at temp agency. And I was very resistant. I was like, why do I want to go to temp agency? I want a real job. And as he explained, he said, well, when you go, they're going to put you on an assignment and then you can put that experience on your resume. That way you have some experience to go in on. And so I said, okay. And so when I put my own ego out of the way, which is what happens, people want to have this all or nothing frame of mind. They want to have their way. They want to, no, I got a medical coding certification, so I want to be a medical coder right away. It doesn't always happen that way for all of us. So just keep that in mind and be willing to accept something that is different from what you actually thought. Try going to the temp agency and getting registered with them and just see, because sometimes these temp agencies, especially these medical personnel temp agencies, they compete for medical coding contracts where they're like contracted to take care of like backlog. And sometimes it'd be like, okay, well, we just need 10 coders. And if that agency happens to have 10 on staff, well, there you go. Because that's a good way to start out, because again, it's not all that pressure, but you are going to be getting your experience. So again, don't turn your nose up at the temp agencies, and it's not forever, it's just temporary. So that way you can start because so many people will spin their wheels and not work and sit there and still complain. You have to get proactive, folks. And if you think, well, why you have to say it like that? Because you have to develop a thick skin. In this industry, oh yeah, you will have to develop a thick skin. And it is for your own good, because at the end of the day, we are dealing with alpha personalities. We have to know a lot. This stuff gets updated, and it is a constant battle with these updates. So, and they happen every single year. But that's the best part of this industry, is because it doesn't get boring. And if you get bored, it's because you are probably doing something that's repetitive, and you should probably try to branch out. At least that's my advice anyway. Hi, Elizabeth. Hi, Katoya. Keith suggested insurance companies. Yes. Hi, Karen. Thank you for all the blue hearts. Hi, CV. Keith says patient access and register does coding. Okay. Jamie, I'm running behind. Hi, Blue. Thank you for all the blue hearts, Jamie. It's all right. We're all here. Justin says, Blue, I'd be afraid of quitting my job for a temp agency unless maybe I could work part-time around my current job. And that's what you can do. That's what a lot of people do. You don't have to quit everything. I didn't quit everything when I got registered with the temp agency. I was still, like I said, I was still working for the halfway house. I was still bartending. When I think about those times now, it's just like my eye twitches because I just, oh gosh. But yeah, I stayed on, with the bar. I stayed on with it because I still had to make that money, and I didn't know how soon they were going to call me. But when I did get called and it was for that assignment, I could still work at the bar because I was working at night, and then I could still work at the halfway house because I was working on the weekends. So this fit right in. Oh yeah, I was working a lot. I was working 7 days a week at that time, just trying to get in somewhere. But once I did that assignment for 3 months, after that 3 months is when I got the big assignment, which was at the place I had to move 8 hours away. And once I did move, and I had to move, guys. I'm not suggesting that you guys move. If you cannot move, it's fine. But I'm just sharing my experience, because I always get a letter from somebody, I can't move. I didn't tell you to move. I just said this was my experience. So when I left, when I had to leave my hometown and move away, I only had to work one job, which was nice because I was at that point I was really tired and I was starting my career. So CB says, good point. Hospital system's a good choice. Yes, it is. CB says, plus, if you're working somewhere that takes up most of your day and that's not what you really want, it could be difficult to interview and stuff like that since your whole day is taken up. Oh my gosh, I see the coffee. Okay. It's coffee. Yes, it is coffee. It is just coffee. Otherwise, I would be getting really giggly if it wasn't. There's two things that happen when I drink, when I do drink. And I don't drink a lot. I drink very socially. If I drink any kind of beverage, it's socially, if you know what I mean. But I get two phases. I start laughing. Everything is funny because I'm funny, you know, funny drunk. Or then I can't hear. That's when you know I've had too much, and I usually stop before then. But if I start saying what, yeah, that's when you know Blue's had too much. But I haven't had too many instances of that, so thank goodness. But as a bartender, you get trained, right, to be able to hold your alcohol. But again, I don't do it very much, you know, and if I do, it's on a rare occasion, and I don't try to make an idiot out of myself either. So I just like to have a good time, and you know, that's it, and not get sick. And but yeah, this is pure coffee. Zaida says, do you recommend to find a code to work remotely? I mean, it's just an electronic encoder, so I mean, you can subscribe to that if you'd like. I've used it rarely. I'm more into the book, you know, if I'm going to do something like that. But if you need it like right away and like you can't really think of like how to look it up, find a code would be good to have as a reference. CB says, oh my gosh, Blue, I bet you know how to make some bomb drinks. I do. My favorite drink to make is a mojito. When I was in the pandemic time, as we all were, you know, oh yeah, that was the first thing I was getting from the store was the mint leaves, my favorite rum. Oh yeah, and the club soda and the limes. Oh yeah, good stuff. Oh, I love that. That's my favorite drink. And I always I put it on I would take pictures of my drinks and I would put them on my Facebook. And of course my friends were like, you made that? And I'm like, hello, past life. I was a bartender. So yeah, you kind of have to go back into that sometimes. And I do it on occasion where I start mixing drinks again, but you know, again, I have to be like in the mood for it, you know, to do something like that. But yeah, I like to make those. And of course I can make margaritas. You got to be a good bartender. You need to know how to make margaritas. I don't drink margaritas at restaurants because they make them too sweet. And if you make them too sweet, that means you don't know how to make them. Because a margarita should not be sweet. Like it's going to break your teeth. You know, it's got to be that perfect amount. And it can't be over poured either. So people say, oh yeah, you got to make them heavy. No. If you're making them right, the person won't even realize it. They'll enjoy the drink. And then when they get up, that's when they'll feel it. And that's how you know you made it right. But yeah. Tina says, I worked for a temp agency during college. They gave me 4 years of business experience when I graduated with my degree. There you go. Zaida, you're welcome. Justin says, I like I like Cape Cod drinks. Oh, those are good. Those are really good and very easy to make, but very good. So, but getting back to the subject at hand before we go off on that, CB says, yes, I like it. Coding and bar tips. What a combination, right? On a channel. I think I've probably lost some people that one just now, but oh well. I mean, it's what I did. It's what I did during that time just to get through. So what are you gonna do? Jamie says, I love margaritas. I do too, but I don't like the salt. I don't do the salt on the, no, 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 no. I mean, you can, and I've made them that way, but for me personally, I don't like that. Yeah, I'm very particular on mine. But getting back to the subject, when you're out there looking for a job, consider all the other positions that they have at the facility. Sometimes you may get lucky if you start sweet talking the HR people at the hospital. If you want to get in at a hospital, that's a great thing because hospitals are bigger. There's more opportunities under one roof. Because once you get started in one department, sometimes it's easy to do a transfer over. However, sometimes people get a hard time when they try to leave because if they're really good and they excel, sometimes the supervisor won't want to let them go. But don't get trapped into that. Okay, guys, it's your career. So make sure that you are out there really trying to be proactive. And just because you leave a department doesn't mean that you're going to forget about the people. Whatever you do can also benefit them as well. So I would try to get into the hospital. Sometimes you can talk to the people in HR, and sometimes they'll say, well, yeah, we have this other position that you may want to look at, and talk to them and see, hey, I have a certification for medical coding and I'm trying to get in somewhere. Do you have anything in medical records? Do you have anything in patient administration, patient access? Do you have any positions in those places? And they'll let you know yes or no. They will also tell you that you're probably going to have to get with the coding manager or the manager of that department and see about a proficiency test. And again, you can also do release of information because that's HIPAA, right? That's releasing somebody's medical records. So you got to make sure that you got all your ducks in a row and you verify who you're giving that information to. But that's making those connections because you're in that same department as the coding people would be in. So it's a good place to start. Good place to start, learning about the different areas, and it makes you more well-rounded when you do that. CB says, I like the salt. Some people do, but yeah, for me, no, I don't. I just enjoy the drink, not the salt. But yeah, that's what I would do. That's what I would say. Absolutely try to work those temp jobs if you can. And you can, the great thing about temp jobs is that you can tell them your availability. That was a thing when I worked for the temp agency too. They said, when are you available? I said, anytime during the day. I said, the only thing I work at night, I bartend and I work at a halfway house on the weekends, but I can stop at any time. And they go, okay, well, just keep doing what you're doing and we'll see what we can find for you. So I said, okay. And so when they came up, it was a week later, they came up with an assignment. They said, we have a 3-month assignment we can send you on. And it said, they're coding the backlog. So you'll be getting experience at the Cancer Therapy Research Center. And I was like, okay, you got it. So that's what I did. I still bartended while I was working. Not a lot, not every day. But I still did that just so that I could keep some money coming in. And lo and behold, I needed that money. But it's just part of, getting into that. It shocks me when I hear that people say, well, I quit my job and I've been looking for a job. Don't quit your job. I mean, you can still schedule yourself for days off. If you're working someplace, schedule yourself for days off. So that can be the day that you go for interviews. That could be the day that you go and you really try to get out there and really look for a job or try to make those calls and make connections. It's not impossible. It takes you to have to get proactive with what you're doing. And don't tell folks, especially if you're at a job and you say, well, I hate this place. I can't wait to get out of here. And I can't wait to be a medical coder. Don't talk about that. You keep your cards to yourself. And then when you're ready to leave, and then when it's time for you to go, and they ask you, hey, where are you going? If you want to tell them, I got my certification as a medical coder, and I'm going to go be a medical coder now. Okay, great. So that way you don't have to deal with any interference. You don't have to deal with any drama. You can keep the drama to a minimum. That's the problem with a lot of things with people sometimes, is that they get so excited, they start talking about their future and start talking about these things, and then all of a sudden you see everything start going haywire. So don't do that to yourselves, guys. Keep the drama to a minimum, and that is the best thing that you can do for yourself, is keep all of your plans to yourself, and then at the end, that's when you can say, but don't go and say this is what I'm going to do, because sometimes people will try to get in your way and sabotage you, and you don't want that, especially at a time that's so stressful like applying for jobs. And if they say, well, can we interview you? If you know you're going to be interviewed, okay, well then you can either say, hey, I have an appointment or something like that. Not all employers expect you to give a reason as to why you need to take a personal leave. You have a personal situation you need to go attend to. You don't have to elaborate the details. And you don't have to be guilty either to say, oh, well, I'm going to go apply for this other job. When they're verifying your employment, all they're supposed to do is call your place of employment, the HR department, and they're just supposed to ask, does this person work there? And that's it. They're not supposed to say, oh, well, so-and-so is trying to go and get a job with us. What do you think about that? Because at the end of the day, if you're going to leave, you're going to leave. And, that's all I would say. And if you're going to use somebody as a reference, make sure that you let them know, hey, I don't want everybody to know about this. If it's somebody that you can trust, then by all means put them down. But at least let them know that you're going to put them as a reference, because if they get a call, they either may not answer, or, they may not be sure that it was you who sent that person to call them. So that's just another thing that I would say. Tina says, I've been having adult hot chocolate holiday time. At a girl. Tequila, sugar rimmed. Oh, okay. Yeah, well, sugar rimmed is good too. They have those too. Y'all are talking about drinks. Hi, Binti. Thank you for all the blue hearts. Tina. It is. I love my Baileys and Kahlua. Don't even get me started with Baileys. I love Baileys. I do. But Baileys makes me very chatty. Y'all think I'm chatty now? Oh, I was at a conference and they were, it was cocktail hour and in the exhibit hall. And so as I'm wandering around, they go, oh, would you like to have some coffee and Baileys? And I said, oh, well, I've never had that before. Because even though, yes, I've mixed drinks, doesn't mean I'm over here taste testing all of them. So I had that and I was just like, oh, this tastes good. And I was just like, And I just start talking to people and I'm like, what is wrong with me? I said, I'm so chatty and I'm over here drinking it. I was like, oh, wait a minute. It's this. I said, oops. And I was like, where's my friend Darlene? I said, Darlene. But yeah, that's what I did. But again, it was like the open house or something like that. So I was like, yeah, I'll take some Baileys. It was so good. And then I made sure I got a bottle when I got home, but but it was good though. I was like, that's a perfect, no wonder why some people love that with their coffee, but I just never thought about it. But I was just like, And it was perfect. It wasn't overpoured or anything. It was just perfect. And that's what I like. Hi, Flora. Thank you for joining me. Thank you for the blue heart. Maria, may I put you as a reference? That's what you want to ask them, right? And that's what you want to say. But yeah, absolutely. Make sure that you ask. Zaida says Baileys with coffee. Baileys with coffee is amazing. I love that. And I haven't tried it with whipped cream, but I would think that would be really good. Maria, you're funny. But that coffee's good. That's just Dunkin' Donuts coffee, though. The hazelnut. And that's just regular creamer. It's not sweetened. So, because I just drink coffee just with creamer. I don't like it with sugar because zing. But anyway, so yes, make sure that you're doing that. There's a lot of adventures that can be had when you first start applying for jobs, but it is an experience. But you got to get out there and you got to stay positive. When I see these people that they complain on LinkedIn, I feel so bad for them. But for some people, there is no giving them hope. There's no cheering them on. There's no saying anything to them because they are they're just done. And they're like, well, I can't get a job. I can't get a job. With that attitude, probably not. You have to make sure that you're willing to start. Well, no, I want to start at this elevated rate. And they said, well, my school said, your school is going to tell you these things because they want you to go into that program. Do you know that if you told people, hey, do you want to sign up for a program where you have to learn medical terminology, anatomy, and pathophysiology? And oh, yeah, you got to learn about medications as well. You got to learn how to be able to maneuver these huge books, at least 3 huge books. And then you have to learn different rules. And then things are not going to make sense to you. And oh, yeah, when you get out in the real world and you start looking for a job, it's going to be hard for you to find a job in the beginning. Do you think people would sign up for something like that? No. They would be like, okay, yeah, no, that's not the job that I want. I want something that's going to be good. So they're going to tell you all the nice things. Oh, all this high salary. So that's why they always say it's up to, whenever you see up to. But people see that high number and that's what they want. And that's what they think they're going to get. And it's just like I keep telling them, you got to look in your area. You got to look in your area because it's going to be different for every place, right? And then there's public hospitals, like, and then state-run hospitals, and then government hospitals. So there, each one of them has a different starting salary too. So when you think about that, it's you add more factors in because there's private hospitals, there's like the Catholic hospitals, and there's Christian hospitals. There's a lot of different hospitals and a lot of different things that they have, and funding for different hospitals comes from different places too. So there's a lot of things that go and factor into those things. The best thing that you can do is prepare yourself, and having to know all this stuff, and instead of getting overwhelmed with it all, and just start taking it one step at a time. Let's see. Tanisha says, do risk adjustment coders work in health insurance companies? I've seen some. I've seen some ads out there on Indeed. And Happy New Year to you too, Jamie. Tina says, I'm so stressed out finishing the course and the exam prep for CPC. I need a job last year. And you will get there. Just keep studying, Tina. Just keep studying. And I know, but you got to make sure that you put things in front of you. Make sure you put your notes up in front of you. Get your flashcards or whatever you have to make notes, and just put them all around, so that way you can have that information readily available in front of you, because seeing it in repetition is going to help, I think, for you in your situation as well. Zaida says, one of the programs offers wow, that's what they say that the starting salary is. Wow, Zaida. Wow. I know you're laughing too, because that's just like, are you serious, people? And do you want people to take this field seriously? You know what I'm saying? Like then be serious about it. Tell people the truth, but be honest with them. Because a lot of people will say, hey, Blue, I'll start out at a reasonable rate. That's fine. And I mentioned a few nights ago, I mean, obviously don't work for $10 or $12 an hour. That's too low. But you see some of these people try to get away with that. And it's just like, really? Especially somebody who has a degree? Because I've seen them try to get away with paying them $12 an hour. And I'm like, no, sir, no, ma'am. No, that's too low. But that's some greedy administrator in there trying to get the lowest rate. And that's not the way to go. When you do that, you get what you pay for. You're just saying. Keith says different jobs, different salaries. Zaida says yes. Jamie says you will find a job. I never thought I would ever find one, and I found this one like 3 minutes away from my house, and I make good money. There you go. And so it really all depends on you. It really all depends on you. But having a positive attitude going in is the way to go. Because the second you start spewing out negativity into the universe, that's what you're going to get back. If you think, I can't do this, your brain's like, okay, we can't do this. We can't do this. So we won't. You have to say, yes, I can do this. All these other people are doing this and they're successful at it. Okay, so I can too. And that's what I'm telling you guys. Whether you are going with a HEMA or AAPC, it does not matter. You can be successful if you want to be, but you have to do the heavy lifting. You got to be able to be in the books and studying. You have to do those things. That's not something that's going to be handed to you. And there's no easy pill for that. There's none. There's none for that, no matter what anybody tells you. And if the program is telling you, oh yeah, The doctors, they just select the codes, and all you have to do is just push them on through. Oh no. If they're telling you that, they're wrong. Because if you're just pushing through these doctors' coded codes, whatever they code, and oh yeah, that's the code that they want, too bad. If the documentation does not support that code, then you need to select the appropriate code that supports that documentation. If you don't, then you just messed up, because that patient either paid too much or too little for their service. And it is on you. We are ethically held to these standards to be able to code these things appropriately. And there is no excuse of, I didn't know. That is not an excuse. So. Jamie says, where are good places to look for free CEUs? You can look for leads for that on LinkedIn. Tina says, Zaida, where is a $70,000 job? So would move for that. Maria says they want their bonus. And that's exactly what it is too, because they have quotas to fill. And it doesn't matter how they get the people in, they just need to get the people in. And they can always say, oh yeah, well, no, the industry changed, or the market changed, or, you know, we said it was up to, so they can't get, you know, their feet held to the fire on that one. But again, you know what I mean? It's just like people don't listen. And when they hear something like that, that's all they zero in on. And so they're like, yeah, that's what I want. That's what I want. Well, who wouldn't want to make that? You know what I'm saying? But again, if that's what you're thinking, that's going to be your starting salary. No. And I hate to disappoint you, but no. I don't even hate to disappoint you. No. It's no. I mean, because that takes time. It takes experience. It takes skill. They wouldn't put unskilled people at that pay rate. No way. No way would they put unskilled people at that pay rate. Jamie says, and it depends on your resume too. That's right. Tina says, thanks for the encouragement, Jamie. Zaida. You can ask the vendor. I wish I could say the name. No. That's funny. But Tina says, I found the Quizlet for medical terminology. Well, great. That's awesome. That's awesome. And thank you for that, Zaida. Thank you for that. I appreciate that. Keith says, do utilization review and management do coding too? Utilization review? I don't think so. That would be, utilization review would probably be like, how are they utilizing the resources? I don't think that they would do coding. I've never heard of a coder under that type of title or something like that. But I mean, they have different titles. Like they have the revenue integrity was for a coder, and I would have thought that was a biller position, but it was actually for a coder position. So it really all depends. You have to read the job listing, and that will really help you. When you're looking at these job listings too, look at not just the titles, okay? Don't just look at the titles. Look at the responsibilities. They'll say this is responsible for. And if you see a lot of those things, and it's going to be under some weird names, it's not always going to be under medical coder, because I've seen people tell me, well, Blue, I looked at my hometown, and it's a big city, and I don't see any job listings for medical coders. And I'm like, okay, that's impossible because you're in a big city. Let's look. So I started entering in all these different names, and all of a sudden all these jobs are popping up. And they're like, well, how did that happen? Well, they didn't come there overnight. It's just the different titles, like health information tech, medical records tech, medical records coder. They will say things like that. It's not just medical coder or medical biller. They'll say revenue integrity, revenue finance. You know what I mean? Like they'll come up with some kind of weird combination name. Every place is different, the way that they call their coders. Yes, Tina. Yes, now you're getting it. Positive thoughts grow positive neural pathways. That's right. That is right. And when you are out there in this big bad scary world of medical coding, oh yeah, you need it. You have to arm yourself with that, because trust me, there's going to be a lot of people that are going to try to knock you down, but you have to make sure that you're ready and you get back up there and you go with a positive attitude, and you look at what you're presenting to the world. You look at your resume, you look at your cover letter. And when you're looking at your resume and your cover letter, you're looking at, am I listing all of my skills? Am I being thorough? I've seen people try to cheat their way and say, oh, ICD-10. Well, there's ICD-10 CM and ICD-10 PCS. So which one are you talking about? And you have to be clear, because sometimes people who have like an outpatient credential, like the CCS-P or even the CPC, sometimes they've been trained on the inpatient side. They just didn't sit for that certification exam. So they could still have that listed as a skill, but they're not certified for that. I mean, but they could still be in it if their employer is willing to cross-train them in it. So, Anne says, hi, Blue, a little off the subject. So what else is new on my show? But what do you think about using the 2021 books to take the 2022 CPC exam? Okay. When it comes to that, so the whole exam is going to be restructured, obviously, in 2022 for the CPC. And yes, there are updates that happened, obviously, for the 2021-2022 time. And there's new updates to these codes. I don't know if it's going to change that it's okay that you use the 2021 books in 2022 because they're updating their exam. I don't know if they're still going to say that that's cool or not. But if they do, if they say, yes, you can still use your 2021 books in 2022, just keep in mind that the CPC exam is a multiple choice exam. The whole thing is multiple choice. Even the newly structured exam is going to be multiple choice. So with that, you may see codes on that test that may not be in your book. Okay. And so you're going to have less questions like about specifically diagnosis coding, and you're going to have less questions obviously on the on each chapter, because it's like 6 questions now on each chapter in the CPT book. So with that, you may have some codes that are going to be updated, and obviously you may see that at the last minute. If they were to ask you a low back question, right? Just for example, if they asked you a low back question on your diagnosis coding, and you have the lumbago code from 2021, and then you see 2022, you see all these other codes there. There's more specified codes. You're not going to have them in your 2021 book. So you run that risk if you do that. There was a lady that said that she was going to write in all the codes that were updated in her book. And that's fine, because that's, use for daily use. So that would be okay to do that writing in your book if you're going to use the old into the new year. So, I mean, if they say that it's okay, then obviously if you want to do that, it's fine. I don't think that the code updates would be so drastic that you would be so lost in your book. So if you see that that's not matching in your book, then you know that that code was updated. So again, you could do like that other lady is doing, and she's going through and writing the updates in her book, so that way she doesn't, her book is essentially updated. You could do that if you wanted. It's up to you. But I mean, to me, I would just go with whatever year, is supposed to be. So if it is a 2022, I would get the 2022 books. I wouldn't chance it with the previous yearbook, but that's me. And that's it. It's been my conditioning to have the appropriate yearbooks, because with a HEMA, and I've taken 3 exams with a HEMA, the CCA, the CCS-P, and the CCS. And every single time they told you specifically what books you had to have. There was no using the year before book. There was none of that. You had to use whatever your test you were taking. If it was a 2021 test, then you use your 2021 books. And so that was the way that it was with them. So I never really had to worry about that. I would want to keep my worries to a minimum as far as the tools that I'm using to take this test. Because I wouldn't want to be trying to flip and look for a code that's not there. But again, I mean, if you're preparing your book, it would be okay if you prepared your book, and wrote in those new codes versus, and then crossed out the ones that got deleted. You could always do that if you wanted. Tina says, what is a reasonable starting salary? Keith says, psychiatry, mental health, and coding. What is different from the other areas? I'll get back to that. Zaida, I will proctor some AAPC exams next year. Oh, that's awesome. I think that would be a fun experience to be able to do, right? Just to, okay, you're there with the future coders. So I think that would be a fun experience. That's awesome. Tina says, utilization with my insurance company approves procedures. Normally, it's someone with medical training. Maria says, I call AAPC and they recommend to use the 2022 books. My CPC test is in February. Yeah, because they load their new exams January 1. And they say that they're that way. So, but I mean, according to the old test, you could, but they said it's up to you. But they said you may not see like the current codes, so they want you to have the best chance. So yeah, I would agree with that too. Anne says, I agree, I will. I'm an AAPC member. Zaida says, the only one you don't need will be the 2022 is the Hicks picks. Oh, okay. That's cool. What is different from other areas? That with those two things, sometimes it's just the behavioral health. I mean, they'll have that. It'll be like counseling, that kind of thing. Sometimes it's more of the in-depth on the psych side. I can't say too many of those words because otherwise YouTube doesn't like it. But if you check in the F series in the ICD-10 CM manual, you'll be able to tell where those start, and those have to be confirmed diagnoses. They can't just be that the patient is having symptoms of, because if it's symptoms of, then you're going to go with the symptom code, that R code. But I do recommend reviewing in your CPT book, especially if you're doing it on the outpatient side, your CPT manual for those procedures, which is in the medicine section, has some of them. And then obviously, yeah, the medicine section is where they're all at. But yeah, that's how you would get to learn those and know those. But that's what I would do. I would review that. I would also review those the series in why am I blanking? I'm blanking all of a sudden. Is it here or is it? I think it's in the medicine section. It's not here. It's not in the E&M. It's been a while since I did that one. But they do have some of those in like the behavioral changes, right? They have some of that. Oh, but that's tobacco and stuff. So no, that wouldn't be that. That's not what I'm thinking. I think it's in the medicine section that I'm thinking. So review that section is what I would recommend. There's not really a difference, like, something that's so different, but other than just following those rules in there, if that makes sense. Yeah. It's in the medicine section. Let's see. Tina says, my advisor said the 2021 books are good until April. True. Keith says, what is different in pharmacy? Why are you confusing me, Keith? What is different in pharmacy? I mean, like, it's still the same diagnosis coding. It's still the same procedure coding, right? Because they have the one for the refills. I don't understand what you mean by what is the difference. There's no difference. All of these specialties, all of these things, they all use the ICD-10 CM book. They all use the CPT book. If you're doing it on the inpatient side, it's going to be using the ICD-10 PCS book. But there's really no difference other than when you get into that specialty, you'll start to see what do they normally report, and then you have to make sure that you understand why they're reporting it, and if they need to be reporting something else, or if they need to add on additional codes or take away additional codes. That's what I would say about that. So hopefully that answers your question. Maria just said that they told her at AAPC that they recommend the current year books. But if you're taking an AHIMA exam, then yes, they are good till April. The 2021 books are good till April. So which exam are you taking again, Tina? Anybody else got anything else? While I wait for Tina to answer my question. This is awesome. I got a big crowd tonight. It's for the closeout episode. So I guess while I'm waiting on Tina to answer my question, incredible year, guys. Hitting 15,000. I think I started this year with like 6,000, or maybe it was 7,000. It was either 6 or 7,000 when I started in January. So I think it's pretty incredible. It's pretty good growth, or may have been 5,000. I'm not sure. Either way, I think we did really good this year. And going through all of these, hey, we hit 10,000 and then we hit 15,000. That's really awesome. And I appreciate all of you guys' support. This is all organically grown support. This is not anything else. I don't have to supplement any of my views because it's all done by you guys. My channel has grown, and I thank you all for that. My Patreon channel, my supporters there have supported me through not one certification that I got this year, but 2 certifications. I use that money to pay for my certification exams, to pay for my additional education so that I can be a better coder for you all. So I have them to thank. It's been an incredible year because of them. And I cannot say thank you enough for that. It's amazing. It's amazing to see progress and what, having a goal and being steadfast in that goal can do. Was it a little stressful? Of course, but was it fun? Absolutely. Would I do it again and twice on Sunday? Yes, I would. I would absolutely do it all over again. For next year, I have a lot of very ambitious goals for next year. 2 very ambitious goals that I have already on my whiteboard in front of me so that I can see it. And seeing that every day also gives me my motivation, because I have to have that in order to get what I want, and which is, moving towards my eventual big goal. You all will be a part of that once those things come to pass. Obviously, I will share that with you guys. But in the meantime, in between time, we will be sitting here having these conversations 5 nights a week. Hopefully, I will be able to maintain that. If not, I will try my best to keep all the juggling going, because it's important to me. It's important to me to be a part of you guys' journey as much as you'll let me, and as much as you may not like the things that I say. You may not want to hear it. It may not be what you want to know or want to hear. I think that when you do hear it, I think that when you have it in your head and you're like, okay, yes, this is possible, but yes, I can do it. I think that when you come out on the other side and you get what you want, I think that it makes things better, because at the end of the day, this industry is all of us, right? Health information is all of us. And if we don't have this communication, if we don't have this platform of, well, there's somebody out there that does say that I can do this, and it's another coder, because as we all know, there is that expression among nurses that say nurses eat their young. Coders are just as guilty of doing that. That's why I try to be as positive as I can and as motivating as I can. And sometimes I have to come in with that reality check too, because there's going to be people out there that will entice you and try to lie to you And I'm never going to do those things. I'm always going to be truthful and honest. I will never bring you guys information about things that I don't know. I will always make sure that I do know. I do know something before I share it with you all. And I would never encourage you guys to do anything that I wouldn't have done myself. Okay. And I've been approached. I've had those scumbag schools that will say, oh, if you promote us on your channel, we'll promote your channel. I don't need that. And especially when you would mislead the people. No, I don't care what you pay me. It's not worth it. To me, I trust me, the money will be there if you let it. And trust me, I don't have to worry. So that's why I say I will do my channel how I do my channel, and I don't have to reach out to these scumbag schools for it. And I do believe people can learn this on their own. That's why I've done the independent learning syllabus. If you follow it 9 months, 12 months, you can get it done. You can do this on your own, absolutely. And you would be learning the same thing that you would be learning in a school. And so that's why, it's there. It's there for you to see. It's there to guide you. But at the end of the day, it's entirely up to you. And however much energy you put into it is however much energy you're going to get back into it. If you're only lukewarm and you say, well, I don't know if I can, and I've got all of these things against me, then you're always going to have those things against you, folks. It's up to you. You have to be your own positive motivator too. It's not just having other people. You have to be self-reliant too, Thank you for all the blue hearts, Aida. No, I don't, Keith. I don't use the DSM-5. Emily, is Maria's test already scheduled for February? It wouldn't let me schedule a 2022 test until January. I think she was just saying that she called there and said that, and asked them, and they said that they recommended that she have the 2022 books. So I don't think that she scheduled her exam yet. Justin, I have big goals too, and I'm glad I can support you with your goals also, Blue. You're welcome. And I'm so glad. I'm so glad that you're a part of it. I'm so glad that you've reached out, and that if you don't know, and Justin, I'm going to brag on you for a little bit. Justin is taking the 13 course bundle through AHIMA, and he is doing this on his own. He's going through the program on his own. He's already been in it 5 months. And so he's pacing himself. He's making his way. He has his goals. He's got his goals set and his eyes set on his certification that he wants. And I believe that he's absolutely going to get it, because this guy has already proven that he can do his research. He's done his research. And when I tell you that he's done his research, he's done his research. Trust me. I hear people who tell me, oh yeah, I've done my research, and I know they have not done a lick of research. This guy, he's done his research, and he's very studious. So I think that he has a very good chance of doing very well in this field. So, but we'll see. 2022 is going to be an awesome year. I think when you have those goals, it makes things a lot easier because you have a path. You know what you want and you know where you're going. And I think that's awesome. Tina says, scroll down. Flor says, and thank you for the blue hearts. Flor says, that's absolutely true, Blue. This course has been, but I think I can make it. I hope I can make it. Yes, you can make it. Absolutely, you can. Maria says, yes, it's scheduled for February and on-site in Florida. Oh, okay. So she's already scheduled it. Oh, okay. Maybe it's a different state. Maybe that's what it was, Emily. I don't know. Maybe the different states have different setups. I don't know. Lady Levi says, hey, Blue, I'm new. Almost finished with the coding courses. That is awesome. Thank you for joining me. And thank you for watching. So to continue on with the conversation, make sure that you're applying for not just medical coding positions, but medical biller, prior authorizations. Prior authorizations will get you exposed to codes, because essentially you are looking at a patient's record and the doctor is saying, hey, the patient has this, and I want to perform this procedure. Can you call the insurance company? That's going to get you a few things. It's going to get you knowledge with the medical record. It's going to get you knowledge with working with the insurance companies. And it is also going to get you knowledge with the codes and the procedures. So that is very important. And when you are putting this on your resume, it's going to make you look a lot more experienced and a lot better because you have had some exposure. Does it matter where I go get certified, AHIMA or AAPC? I've always said either one of those is fine. If you choose AHIMA, that is great. If you choose AAPC, that is great. Either one of these is what the employers are looking for. When you look at job postings in your area, you will see that they will ask the candidate must be certified through AHIMA or AAPC, and they'll say sometimes that they must have a degree or you must be certified through AHIMA or AAPC. So either one you pick is good for you. There's not one that's better than the other. But there is a gold standard of medical coding credentials, which is the CCS. And I say that because when you look in the job listings, you will see a lot of them ask for the CCS. A lot of them ask for the CPC as well. But the CCS, there's a lot more places that you can apply with the CCS because you can apply it for inpatient positions as well as outpatient positions. So there's a difference because there's a different setting. And you have to know, with the CCS, you have to know how to use the ICD-10 PCS manual as well as the CPT manual because it covers both inpatient and outpatient coding. So that is something to know. With the CPC, which is the entry level, it's the CPC-A when you first get it and you hadn't had experience as a coder yet. The CPC-A is all outpatient coding. So it is just the CPT, of course, the diagnosis book and your HCPCS book, but it is all outpatient coding. So if you were only trained in the outpatient setting, then that's something that you can look at. AHIMA has a credential that is all outpatient as well, and that is the CCS-P or the Certified Coding Specialist position-based, and that is all outpatient coding. But it is a challenging exam as well. So you do have to make sure that you do your research as far as like which one you want to sit for. With AAPC being updated with their exam, right? Next year, well, in 2022, in a couple more days, they're going to switch to a 100 question exam, and it is going to be 4 hours. And before, it used to be with AAPC that you could get a free retake. They're not doing that anymore. Apparently there's a charge for the one try, or there's a charge for 2 tries if you want to do the tries twice. Sometimes people get very nervous with taking tests, so sometimes having that extra backup makes them feel better, so they might want to do that. With AHIMA exams, it's one per fee, so if you fail, you have to pay to take it again. So with AAPC, they give you that little bit of an option. And if you do decide to go with AAPC, you can it'll have that A, like I said, the apprentice status. You have that for 2 years. There is a 2-year time commitment on that. They essentially want you working for 2 years before they remove the A. You can accelerate that process by taking their Practicode as an educational program for an additional fee. I say that if you're already working, you already have your job. People get jobs all the time with the apprentice status. And if you're already working, why do you need to spend more money to do something when you can get a workbook and work through the workbook? I always recommend workbooks. I like workbooks better because to me, it's self-paced. You can go at your own speed, and you have the book to work with rather than just constantly staring at a computer screen. But that's just me. But that Practicode covers 1 year. And so all you'd have to do is basically work 1 year, and then if you're working that Practicode or you're doing the Practicode concurrently, you can get that accelerated removal of the apprentice status. So you'll have your CPC within a year. So let's see. Emily says, I'm doing it online in North Carolina. Keith says, what is the difference between a nursing, professional coding training, or other clinical, professional physical therapy, or occupational therapy? Lady Levi says, I heard the AAPC is all multiple choice. AHIMA is 70% multiple choices, and 30% you need to study. You need to study 100%. Emily says, I was told AAPC offers a lot of free CEUs. It's not technically free because you're paying for your membership. You have to pay a membership fee every year. And that's the difference too. If you are with AAPC, you have to pay your membership fee every year or they will revoke your credential. And that's just the way that they have their program set up. And that could account for some of those free continuing education units. You do have to have 36 to be able to maintain one, and you have 2 years to get 36 continuing education units together. It's not hard, but I think that them including those CEUs, it's not technically free when you're having to pay for your membership. With AHIMA, you don't have to maintain a membership. They have a separate price for members and a separate price for non-members. Tina says, prior authorizations job wants 2 years of experience, at least here in North Carolina, South Carolina. Maria says, I suffer from test anxiety. Zaida says, I got all my CEUs through my chapter. See, that's awesome. See, and that's why I say it's not that hard to get them. I mean, they're easy to get, but you want to make sure that it's stuff that you are learning as well. And Maria, as far as like your test anxiety goes, everybody goes through it. Everybody goes through it. The thing about it is, I always tell people when they say, Blue, I'm really scared of taking this test. I'm really scared of this test. If you're always going to have that fear, it's always going to have control over your career, over your life, over your earning potential, everything, by having this fear. Now, what is the worst thing that can happen with this test? The worst thing, honestly, truly, the worst thing that can happen with this test is that you fail and that you have to take it again, right? That is literally hands down the worst thing that can happen. But if you look at it and you say, okay, well, I'm going in there and I know because I've been trained or I've done a self-study. And it's not like I'm walking in with no knowledge at all. And it's not like I'm walking in where I have no books. I have my books. So it's an open book test, and it is things that I have learned over the past few months, and I am ready for this. It's a lot of self-conditioning by positive self-talk. A lot of times people have this test anxiety and they're beating themselves up at the same time. Gosh, I don't think I can do it. I'm stupid. I don't know what I'm doing. This is wrong and I'm wrong. And if you have that, then your brain's like, okay, yeah, we're stupid. We don't know. We've been wasting our time essentially doing this program and learning this stuff because we're never going to pass this test, right? That's the worst thing that you can do to yourself. The only person that can stop you at this point is yourself, right? Because again, if the worst happens, you take it again. But you know what? When you take it again, you're starting from experience, not from scratch, right? Because you already know what to expect. So I tell people the best way to eliminate some of that fear and worry is to get yourself familiar. Set up a mock test for yourself. Get that CPC exam prep book, right? Whatever it's called. And I can never remember the name of it. But get that book. Set up that time that you're going to be taking that exam, whether it's the 4 hours, right? Or the 2 hours at a time. But if you can spare that 4 hours, go to a place where you can just isolate yourself, turn off your phone, don't have anything, and pace yourself through a 4-hour type setup, okay? And then from there, you can grade your test, see where you're at. Don't rely on those results, but just pace yourself and see, okay, well, I made it through this much, I got this much right, and this is where I need to work on. I've been reviewing my book because that crazy medical coding with Blue lady is constantly telling us to open up the book and look at each page of the book. And I got so tired of hearing her say that I started doing it. And now I know where everything is at in the book. That is going to take away a lot of that. Okay, well, I don't know where anything is at in the book. And I have all my tabs here. The person who's been listening, the person who's been doing that, who's been opening up the book and flipping each page is going to say, oh, yeah, I know where to find the E&M section. Oh, yeah, I know where to find the The appendix is back here. Oh, I know what appendix I need to go to for all of my definitions on the modifiers. And I know my modifiers. I know what modifier 25 is. I know what modifier 24 is because, again, I watched Blue's modifier series for the 13 days that she did it because no one else wanted to watch it, so she stopped. But it is explained there on the big ones, on the majority of the big ones. So I can look at her video again and listen. Oh yeah, modifier 25 is for a separate evaluation and management service on the same day of a minor procedure. I know that 24 is when they have a evaluation and management service while they're in a global period. Oh, what is a global period? A global period is either 0 days, well, not 0 days, but like 10 days or 90 days. And that is all those visits that are related to that particular condition. They're going to be covered under that time. So that is covered under the global period. Essentially, that patient has already paid for their service and they're just coming back for those return visits to make sure everything's okay. But the doctor's already been paid for. So anything that's having to do with that is already covered. And so that's what those things mean. But if you're doing those things, you're going to be a lot more relaxed when you start looking at these books. You're going to start saying, okay, I'm more confident because I flipped through every single page of this book. I've been reading my coding guidelines every single day. So that's making me faster at reading. And when I'm faster at reading, it's going to make me go faster through these big op notes that I see. And I'm not going to be so intimidated because I'm going to be able to conquer that just by looking at it and be like, oh yeah, that's just a few paragraphs. I have been reading the whole coding guidelines once per week for weeks now. And, you know, even if it takes me 2 weeks, I still have completed that whole thing several times. So I know my coding guidelines. I know how to look stuff up in the book and I can get through this book efficiently. And I know that I'm not going to waste time looking in the index. I'm going to go straight to the tabular section because I know that by looking at these code ranges, I know essentially like, okay, this series is within this code section. And I know that the 10,000 series, that's my integumentary system. The 20,000 series, that's my musculoskeletal system in the CPT book. And so if I know that's the procedure codes and the ranges I need to be in, I can eliminate something that looks weird and funky. I'm going to be able to focus that way. So that when I get done with this test, I'll know that I did my best. And that this time for me studying is just temporary. It's not forever. It's not going to be the rest of my life where I'm having to do such intense study. But this is going to be better for me, my family, my kids, my sister, my brother, somebody that's looking up to me. I know that that's going to help them by seeing me reach my goals. And I know I can reach my goals. And that's what you got to tell yourself. You got to be your own hype man, people. You got to be able to tell yourself, yes, I can. These books are not so scary once you keep looking at them. And if you don't want to read, that's okay. Just looking at the pages is going to get you familiar. Even I looked at this book, well, not this one, but the 2021 book. I looked at it so that I was familiar with it. Same thing with the PCS, the ICD-10 PCS manual. I have no inpatient coding experience. But when I sat for that CCS exam, oh yeah, you betcha. Was I nervous? Yes. But I knew I was prepared. So the day that I took my CCS exam, I was like, no, I've got this. I'm prepared. And I didn't study for a couple days beforehand because I was just like, I'm not going to learn anything new. I'm not going to try to cram and push a bunch of information down at the last minute thinking that's going to help me. All it's going to do is just freak me out. So I don't study a couple days before the exam. And I had slowed down on everything else. So just getting through the exam, going through and just going in there, I was like, okay, I got this. Watching the time and not panicking, making sure that I say, okay, I've got this. I'm going to get this done. Because when I looked at that first hour go by and I looked at how many questions I had left, I was like, oh yeah, I got to hurry up. So I started picking up the pace, and at the end of the day, you're on the fence, just pick one and move on. Do not lose the whole exam because you're stuck on one question. That one question is not worth the rest of those questions. So just make sure that you're giving yourself some slack. Not everybody does it right the first time, but at the end of the day, you're in there. You're in there. You are doing something that a lot of people can't even bring themselves to do, which is even schedule the exam in the first place. to even get to the testing center or to be at their computer doing the testing themselves, at home thing, so you're doing something, you're making effort, you're making those strides. Every step forward is that next step towards your goal. And having that oh, I can do this. Every time you start thinking it, don't even think it. Don't even let the devil get in there and say, oh yeah, you can. No, you can. You absolutely can. And when you have to put it up on a whiteboard so that you can see it, you can put your name, you can put your future credential, what you want, and you can put I will pass. And you can put it right there where you can see it, because a lot of times that's what you need. That's that visual. That's getting what you want. Because I hear from people all the time that tell me, Blue, I want to live in a nice place. I want nice things, and I want to be able to do things for my kids. Okay, this is a very good field. It's going to get you there, but you have to be there, and you have to get in, and you have to pass those exams, and you can do it. People don't give themselves enough credit. And remember, you know more than you think you do. Trust me. There's a lot of times when I'm just sitting there, I'm like, okay, somebody asked me something, I'm like, well, isn't that, when, and I'll say something, they're like, yeah, how'd you know that? Well, when you review, you review. So you guys, you can do this. And 2022 is a great time, right? It's going to be a great time to be able to start all that stuff and get there and get what you want, because anybody can. There's not anything that said, oh, only people like this can do better, or only people like this can do well. Anybody can do well, but you have to get out of your own way, and you have to be able to say, yes, I can, because you can. Kunta, do you know if the two programs offer financial aid? I know the AAPC has payment plans, and with AHIMA, you can pay by course. So that is pretty much that. But AAPC does have payment plans on their website. Wings says, do you have to practice your speed in coding for the test? I use an encoder. I haven't coded from the actual book in years. Oh, no, you need you need the books. Absolutely, you need the books. Because if you are, that happened to me. That's what happened to me, was I lost my speed with the books for many years because I was so dependent on the encoder. So yeah, you got to make sure that you start getting back with your speed, because if you're lost and you don't know how to use these books and you've become solely dependent on that encoder, yeah, you're going to suffer. So make sure you start reviewing your books. Please make sure that you review your books, because you will not have access to an encoder at all for any exam. You have to use the book. Absolutely. Love says, I'm currently a medical assistant. I handle authorizations for radiology exams. I realize I enjoy the ICD codes and CPT codes, and I really think I would love and enjoy becoming a medical coder. That's great. Keith says, I see RNs who are coders too. Are there medical professionals? What would you say would be the difference between the background? And I'll get to that. Lady says, thank you so much for explaining so much about coding and testing. You're awesome. This is very helpful and informative. Oh, thank you. Encoder dependitis. Oh, I love that, Saida. Yes, but that's what happens. And then when you get there, it's just like, I was so afraid I was never going to get my speed back. That was what I was afraid of a couple of years ago, because when I started to mess around with this, and especially with the channel, when I started my channel, of course, having my CCA, and a lot of people said, well, what degree do you have? And I said, I don't have a degree. And then they go, well, what do you have? And I was like, I have a CCA. And they're like, oh, I thought you had a degree, and I thought you had, the CCS, and, you only have the CCA. Wait, don't say only, but yes, that's what I had. I didn't think that it was a big deal. But when you get on a platform like YouTube, and it's just like, okay, now you got to start stepping up your game, because your knowledge base does need to match your credentials. And because I knew I had way more than just the entry for the CCA, I had way more than that, So now it's just like, okay, so this year was like, okay, I got to make sure that I start stepping up my game on my credentials. And that's why I did what I did. But when I knew I was going to have to start doing this, I started to get more familiar with the book, because again, I had been away from the books for a long time. It wasn't that I was constantly with the books like I am now. Back then, when I first started, I was like dependent on the encoder, the encoder dependitis. But that's where I was. And so, when you do that, you do suffer. So that's why I say get familiar, start working with your speed. Maria says, thank you so much. I needed someone's encouragement. Thank you for all the blue hearts. And of course, Zaida says, I love 3M. Now learning Optum. I love 3M too. 3M is really awesome. And I love Optum. You all know how much I love Optum. But Keith, as far as your question with nurses who are medical professionals and they go into the coding. So yes, nurses do go into coding. And sometimes they start off as medical coders and then they work their way up to being a CDI or clinical documentation improvement. Because of their clinical background, they are able to spot things faster than the standard coder. If a standard coder has not tried to learn more, be more in depth with their learning, they can miss things that a nurse can be able to spot. Somebody who's had a lot of training in coding will know after a while with experience where the holes are. And a nurse coming in is going to have that strong pathology background, pathophysiology background, and they're going to be able to know, okay, well, this procedure was done, but there's something missing here. And they work with the providers to better the documentation so that the full picture comes out in the documentation, whereas a coder is only as strong as they want to be. And, sometimes they can not always see that because they don't have that clinical knowledge. And so, with nurses, it's good for them, especially when they have been bedside for many years and they still want to use their knowledge, but maybe bedside is physically hard for them now. And, nursing is physically demanding. And after a while, you get to a point where you're just tired, but you still want to use your knowledge. And coding is a good place for them to go because it's not like they wouldn't be able to use it. They can absolutely use their knowledge, and they can become really good educators as well. And a lot of them go on to write coding books, and I've seen it. So it really is dependent on the nurse. I have seen nurses who are very excited. They want to be a medical coder, and then when they start learning it, they're like, what the heck is this? Because I've tutored many. I do medical coding tutoring, and I've seen many of them coming to me and they're like, Blue, I don't understand. Like, what is this? This is hard. This is not what I thought it was. Because a lot of nurses get exposed to coding by simply circling on a super bill a code that they say, okay, well, select this one and select this one. Oh, okay. And so this is pre-done list of codes, and that's what they're selecting. That's not coding. Coding is actually looking at a documentation and saying, okay, there's this going on, and then they did this. And so we're abstracting, we're actually comprehending what we're reading. We're not just checking off boxes, right? And so that's what the difference in coding is. It's not just selecting something or pushing something through. It's actually looking at it, comprehending it, and translating it into codes, diagnoses, and procedures. So, or evaluation and management levels. So there's a huge difference. And I think when nurses become medical coders, I think it's a great thing. Anybody coming from the medical side into coding, techs and whatnot, it's a really great transitional field. But they will soon see, it is a completely different ballgame. I mean, we speak differently. Coders speak differently. And even my providers will catch me. They're like, Blue, you're speaking coder again. And I'm like, okay, right. I gotta change it. But with nurses already have a built-in relationship with providers. And sometimes if a provider sees a nurse medical coder and a medical coder, they'll say, okay, it'll be easier for them to talk to the nurse because they're used to talking to nurses. Whereas sometimes they don't know how to take us as medical coders who are not nurses, right? Because sometimes some providers have been abused. I mean, there's no other way to say it by some of their coders, because sometimes coders will only go to providers when things are wrong and things are bad. And they're always telling them, you're doing this wrong, you're doing that wrong, you're doing this wrong, you're doing that wrong. And so rather than encouraging them and saying, hey, we're a team and we're going to work together, they will have a bad impression of medical coders, which I think is terrible. And I have a provider who's leaving in summer of next year. And he said, his colleague said, well, hey, bro, you have to know how to code the stuff on your own because these coders don't know what they're doing. And that was like a knife in the heart. I was just like, ouch, you know, and he's like, not you. He goes, I know you do. He goes, but he said that you can't, like they've had terrible coders or they've had coders that just didn't care. And sometimes I don't think it's that the coders don't care. I think it's because they're not being educated. And I think sometimes it's hard to ask for help, especially if the coder is intimidated and doesn't want anybody to think that they don't know. And if that's your problem, like you don't want people to know that you don't know something, this is not a field where you can be so like proud, okay? You need to be able to be humble. There are times when I'll be like, I don't understand what this means. And it takes a strong coder to be able to say, I don't understand what this means. I've done my research, I'm trying to look this stuff up, and it doesn't make sense. And you have to be able to say that. But you have to know that doing your research is going to help you first. Then going and presenting your research to somebody who knows. And if it's not a medical coder, if it's not your supervisor, and if it's your provider, you say, I need some better understanding of what's happening here because I want to make sure that the correct code is being selected. So this is what I found for this, but I also found this for this, and it looks like it's related, but maybe not. So which one would you help me to understand? Like, what is the difference between these two? And you would be so surprised. Like these providers, some are very happy to help, and they'll be like, oh, okay, well, as a matter of fact. And then all of a sudden you're learning something together because you'll get that feedback of, I didn't know there was these different codes for that. Yeah. Yeah. And I said, so when my providers have said this to me, they're like, well, I didn't know you had to go through all that, Blue. And I'm like, there's a lot of stuff that you don't know that I keep from your precious ears because this stuff gets intense. It gets very detailed, and you have to be a detailed person to work in this stuff and to be able to get the highest specificity in these codes. So, you know, it makes it a good thing. And the side bonus of that, when they see you, they know they can trust you. They know that you are there and you're doing your job and you're actually doing the research and you're actually somebody who cares versus somebody that is just going to push on everything on through. And if they get credit, they get credit. If you don't, you don't. You know, they'll know that you're actually putting in an effort. So, hi, Tawana. Mist says, oh, long time no see. It's been a while since I've caught a live stream. Been busy. I'm so behind. It was good to see you, Mist. Hi, Tawana. Thank you for all the blue hearts and the green hearts and the diamond. I have good news to share with you. I'm speaking positively and speaking it into existence. I will be a front desk medical assistant in which I'm good at front desk, in which will it give me experience towards a medical coding career. At the front desk, it depends. Sometimes they have those front desk ladies do a lot. So it really depends. If you are working with selecting the codes, then absolutely. If you're not, just make it known that, you know, you're interested in the coding. Make yourself available for learning. And if there is a coder in the office, try to make friends with them so that you can kind of, you know, okay, oh, you need somebody cross-train in here? Oh, I'll cross-train. I'll do something like that. Be proactive. But yes, you're already doing good because you're in there. And that is the start. And like I said, I've seen some of the front desk ladies, they're actually the ones that are doing like the circling of the codes and stuff like that. So they're doing the super bill stuff. But it doesn't mean that you can't apply your expertise in the things that you know about coding to be like, okay, well, wait a second. You did this or you did this or, you know, whatever. Let's talk about this code selection here. There's a more specific code, or, hey, did you look at this procedure code? And that kind of thing. So that's using your knowledge and be like, hey, this person's pretty valuable in this position. What is she trying to do? Be a medical coder. Oh, okay. Well, we need one. There you go. And you're in. Love says, would you say coders are more behind the scenes and rarely interact with patients or not at all? We have no interaction with patients at all. The only ones that do are the billers, right? Because the billers are trying to collect money and they're calling the insurance and things like that. But we as medical coders do not have contact with the patients at all. Infinite, hi Blue. Thank you for all the information you give about medical coding. You're very knowledgeable. Thank you. Tawana says, speak it, and I like the hearts. I just got into the live, and I don't know if you answered this question. I'm a 39-year-old man and would like to get training for medical billing and coding. Do you think the courses on the AAPC website and AHIMA are better than attending a technical school? And that depends on you, because the online courses with AHIMA or AAPC are self-paced. So you're essentially going to be learning on your own. You could be potentially doing that if you go to a technical school. Technical schools tend to be more expensive because they are technical schools, and they want your money, and they're there for profit. Whereas the association, this is just a side benefit of getting educated through the associations themselves, and it is a fraction of the cost. Because technical schools can run you $10 or $20 or $30,000, sometimes 40 or 50, and then you see the AHIMA or AAPC programs, and they run roughly $4,000, give or take, with all the books and everything. So that is the difference there. But yes, I absolutely recommend going through AHIMA or AAPC. If you find a really good program and the instructor is really actually hands-on and not just reading from a book, then you're fine. But if it is that, you're just looking for a cheap way, to get educated, you can also do the self-study. I do my independent syllabus. I have it out. And I'll probably leave it in the description box once I update this video. So that way you can check it out if you're interested in trying to study it on your own. But if you want to go through the school, I obviously do recommend going through AHIMA or AAPC. AAPC has payment plans on their website, and AHIMA has the courses a la carte, so you can pay for a course at a time. So you can absolutely do that if that is of interest to you. Mist says, when did you start teaching online? I have my Patreon channel, but I am not teaching. I'm not teaching online. Tawana says, my dream is to become an OBGYN coder. Well, there you go. That's awesome. Miss says, I have a lot of streams to catch up on. Yes, you do. Love says, thank you so much. Appreciate you. You're welcome. Justin says, Infinite, have you taken a look at AHIMA's 13 course bundle, which is what I'm doing right now? CB says, Justin is so expensive, and AAPC is expensive too. Zaida. Justin, yes, it is, CB, but the AAPC costs more than AHIMA's because they charge separately for the medical foundation and the coding. CB says, Blue, from your experience, how do employers look at jobs on your resume that may not be related to coding? Haha, sorry if you mentioned, I went away for a moment here. So the jobs that you have on your resume that are not related to coding, what you want to do is you want to highlight the transferable skills that you have from those jobs. And I say you can have transferable skills from anything. If you worked at Dollar General, you did cash handling, cha-ching. Okay, you work with cash, you worked with a credit card machine. That would be helpful for somebody who does medical billing. So then you would say that. You would also say that you worked with customers and customer service, because obviously if you work at the Dollar General, you're going to be dealing with customers, and you have dealt with, you have de-escalated customer situations from getting out of control, because that's what they do. They're very calming sometimes. Like the people who work at the Dollar General right down from the street from my house, they're so nice, and those people can get out of control. But they're like, hey man, it's gonna be all right. And all of a sudden everybody in the store is laughing. So it really all depends. Everything that you have that can be transferred over, because a lot of times you see in these job listings, candidate must be able to work with teams, like work in groups and things like that. Again, if you worked at Dollar General, if you worked at a fast food restaurant like Wendy's, with their delicious breakfast. If you've worked in those kind of situations, you're working in a team. You're part of a team, so you can work cohesively in a team setting. You can also work independently because there are things that you have to do by yourself, right? There's tasks that you have to do by yourself, especially if you're working as a line cook. You have to clean off the grill, and you got to be able to stock the refrigerator, and you got to make sure that you have everything that you need, and your buns and your bread and all this other good stuff. So there's all of those things. You can work independently. You can work in groups. You've handled cash. You know how to handle customers. Again, looking at your dream job website, the job listing, you'll be able to see what it is that they're looking for, and any of those previous jobs that you had, anything that you can transfer over, that's what you need to highlight. So Justin says, it cost me close to about $5,000 for my program. I had help from family. I'd say look at Bleu self-study and tutoring options. CB says, plus the A part, apprentice, costly to get off. Miss says, I meant these types of streams. Sorry about that. Thank you, Tawana, for the blue heart. Hi, Minnie, I'm doing great. Infinite says, thank you, Bleu, and it's BLEU. Like the sign. And Justin, no, I haven't, but thanks for the heads up. I will take a look at it, and I appreciate it. Okay. So I've had a pretty good crowd here tonight for the closeout show for 2021. This is so awesome. Thank you guys for closing it out on a very high note. I appreciate it. I am so happy that you all have been here and that you all are asking questions about your journey. I'm glad that you're doing your research. I'm glad that you're taking those steps forward. You're doing something positive for yourself, and know that you're not being selfish when you're trying to make a better career for yourself so that you can provide better for your family. There's nothing selfish about that. And don't ever let anybody make you feel guilty about that. CB says, Bleu, another helpful video. Thanks. You're welcome. And thank you for all the hearts, Miss. I appreciate that. It makes my screen look so pretty. Yes, Karen, Happy New Year's to you too. And thank you for all the blue hearts. This is going to be awesome. And so please be careful out there. If you are traveling, if you are going to be on the road for New Year's, I always stay at the casa because I do not go out. I will not take a chance in being out on the road. I never go out for New Year's because people are nuts on the road. So if you're going to be out on the road, please be careful. Like I said, I just get nervous for New Year's. But don't drink and drive, whatever you do. Okay, be smart, people. Stay safe. Okay, use hand sanitizer. Stay safe and stay well, stay healthy, so that you can get into the new year with your goals, and you can do all of those things and put one foot in front of the other. Don't get discouraged, guys. Discouragement is part of the journey, though. But how you handle that discouragement is going to either set you up for success or set you up for failure. You can use that to propel you forward. That will drive you if you let it, and as far as like, okay, I can't fail at this, I'm going to do this. It's all about that. Wing says, Happy New Year. Justin, Happy New Year's, Bleu, and all, and let 2022 be better than 2021 for all. And Maria says, Happy New Year's to you too. So on that note, I'm going to go ahead and wrap this one up because otherwise I'm going to have a really long live again. And I don't know how into the video people get anymore with these, but we just tend to have talks and have a good time. So I hope somebody enjoys these anyway after this. Miss says, me too, I'm staying home too. Woo woo! Flora says, hopefully you have a wonderful time tomorrow, New Year's, Bleu. God bless you. God bless you as well. And hopefully next year is a wonderful year for you and all. Infinite says, I appreciate you, Bleu. Thank you. And Happy New Year's. Happy New Year's to you too, Zaida, and to Infinite. Well, I'm going to go ahead and wrap this one up. I will see y'all again in 2022. Make sure that you like, subscribe, share if this helped you. Check out my Facebook page. I'm on Facebook if you are looking for a Facebook page to follow. Medical Coding with Bleu on Facebook. If you are looking for extra exercises into the new year, I have my whole E&M series out. I'm breaking it down to the genesis of E&M finally on Patreon. So it's patreon.com/medical coding with Blue if you're interested in that. All of my contact information will be in the description box once I update this video, and you will know because the thumbnail will be updated. It won't just be a white background. It will be updated, and that will have all of my updated information. So again, Justin says bye, and Love says Happy New Year. Can't wait for your next live, and I will see y'all in 2022. Bye.